Thank you very much, Duane, and good evening. It is really a pleasure to be here today. I'd like to extend my deep appreciation to Mayor Karen Bass and her team, and to our partner CalMatters, who helped us today with this event, and with several campus partners, including UCLA Government and Community Relations, our UCLA Events, Blueprint Magazine, UCLA Luskin School of Public Affairs, and UCLA Health. And as a public research university, UCLA is always seeking opportunities to help educate and inform our brewing community and the community at large on matters of civic importance. 10 years ago, Jim Newton, a veteran author, teacher, and journalist, created Blueprint with the aim to connect policymakers, academic researchers, and the public. It is a magazine about improving Los Angeles and California, and about the people and institutions charged with doing that. And this evening, UCLA is pleased to relaunch a series of conversations and gatherings focused on the topics outlined in Blueprint, which range from climate change to education, to labor, and to immigration. We are honored to hear firsthand from Mayor Bass, who declared a state of emergency around homelessness on her first day as mayor in December 2022. And while her initial emphasis was on getting unhoused people off the streets, her office is now turning to longer-term solutions such as housing. Earlier this year, Jim sat down with the mayor to interview her on the topic of homelessness, which is featured in our spring 2024 issue of Blueprint. Nearly 2 years into her term, with major international events scheduled in the Los Angeles area over the next several years, our event today provides opportunity to check in to see if we are on the right track for confronting homelessness. It is now my privilege to turn this event over to a colleague whom I deeply respect, Jim Newton. Thank you.
Thank you, Yolanda. Thank you all. Thank you all for being here, for being in downtown Los Angeles at the end of a workday. I appreciate the effort that takes. And of course, a special thank you to you, Mayor, for being willing to spend this time with us. So I'll get things going here, and we're here to talk about homelessness, which is what we'll spend the bulk of our time talking about, but it does seem a little bit malpractice of me not to start by asking about the national elections, and so I apologize.
That's what I think.
We all know what happened. To localize it, any sense from you of what this means for Los Angeles, for you and the work you're doing here, the election that we just had?
Well, yes, and I think, it's interesting because in the matter of like 5 days, we all went on this unbelievable emotional roller coaster. On Friday, we had 220,000 people out here celebrating the Dodgers, and we were as high as we could be. And by Tuesday, it was like, the roller coaster went downhill and crashed. So I think it remains to be seen. First of all, I want you to know that I'm trying to do everything I can over these next 2 months to get every policy, every dime that is headed our way to be here. I worry about grants where the money is not here. I don't mean encumbered, I don't mean awarded, I mean the check is in the bank, because pretty much anything can be stopped. I think it's good. We're going to wait and see some of the appointments he made. You and I were just talking that the appointments that have been made in the, I know these folks. I served with them, and these are like bizarre appointments.
Matt Gaetz, what could go wrong, really, right?
Well, I just recall the time I almost had to break up a fist fight in the Judiciary Committee between Matt Gaetz and somebody else. Unfortunately, I was sitting in the middle, so I was able to hold them off each other. But seriously, we don't know who he's going to appoint to HUD, for example. But what we do know, if you read Project 2025, and although he says he had nothing to do with that, the man that he appointed around immigration wrote the piece on family separation and immigration in 2025. And so 2025 calls for, they don't outright call for the dismantling of agencies. What they do is that they redistribute the work of the agencies. So I looked at DOE, the Department of Education, and HUD, and they basically take the major programs and put them in other departments which is a sure death because the other departments have a ton to do. It's not their focus. And so I think that's the way they provide cover. The deal, though, is that he can do what he wants with HUD, but the reality is housing is a crisis nationally. It is not just our crisis. I did join the U.S. Conference of Mayors right away. I chair the National Task Force on Homelessness, so I've gotten to know lots of other mayors. And one of the things I've discovered on this journey I've been on for the last 2 years is that, yes, my focus has been getting people off the street, but my focus has also been trying to change some of the dysfunction in the system. And then along the way, I keep running into either laws, regulations, or policies that literally either make people homeless or make it so difficult to get them off the street. And the one that I've been working on that I'm excited, we've had success, and that's with veterans. You know, if you are a veteran and you receive veterans benefits, we count it as income. And then we say you make too much money, so I can't give you this voucher. We literally have 3,000 vouchers in the county. We have we have beds that are vacant because they're only for a veteran with a particular type of voucher. And so there's so much of this system that you have to unravel while you're trying to address the problem at the same time. And I don't think, and those of you that have been involved far longer than me, I don't think there has been a lot of attention paid to the rules, the regulations, the laws that are roadblocks in us being able to get people housed.
And are those is there any prospect of those getting better in the near future?
I think so.
Good.
You know, I mean, first of all, I did spend 12 years there. And 8 out of those 12 years was under Republicans. Well, actually, that's not true. 4. But 8 out of the 12 years were under Republican-controlled House. And I learned how to work in a bipartisan basis. And for whatever reason, even some of the most hardline MAGA folks I've worked with very well. I compartmentalize. And so I don't just assume that I can't get anything done. It's just that I'll have to get things done differently. So sometimes deregulation can be a good thing.
It's a word you'll use often, I guess, in the future.
I did before.
One last question about this sort of national-local interaction. Chief McDonnell, now Chief McDonnell, went out of his way last week, as did you, to note that the LAPD would not be involved in assisting any deportation efforts, which goes back to Special Order, Daryl Gates, all of that.
Believe it or not.
So there's an ancient history there, too. Is that a sign of things to come, of the city standing on certain principles?
Well, I mean, I think it is, although, you know, what you won't see from me, I don't think, well, you know, I don't grandstand. I try to get things done. So I will be very different than I was when I was in Congress chairing the Congressional Black Caucus while Trump was president. This is different. We have all of these events coming up. We're going to absolutely have to have federal support. But I think what you saw last week, though, was you remember when Trump was in before. Now, again, most of my time was spent fighting the policies in D.C. I wasn't fighting them here. And you remember that even before the immigration stuff really was implemented, the fear, the terror. And I know that the immigrant population and mixed status families, everybody, when they heard the rhetoric on the campaign trail, you know, was scary. And now the idea that he was elected again, the most egregious part that just sits with me, to this day, seriously, are the 12 to 1,400 kids that are out there that are floating in our country. We don't know where they are. When they first started family separation, they didn't take good data. They didn't document. They wrote on pieces of paper, and they lost track of the kids. The parents were deported, or in some instances, the parents might be in the country. So what I saw last week during McDonnell's confirmation was all of that coming back to, you know, life. The terror, the fear. You know, anybody that tells you they're going to use the military and go door to door. You know, the reality is some of what he is saying cannot be done. But like I said, it doesn't, I mean, obviously it matters. But the fact that the words were said is the terror that the families have.
Yeah. I hesitate to call it happier news since it's homelessness, which is hardly happy.
Let me mention
but-
one more thing.
Oh,
I'm
please.
sorry.
Yeah.
So the Sanctuary City, you probably have heard me say this before. I remember when we did Sanctuary City years ago, but I didn't realize that that was an executive directive. It wasn't an ordinance, so it's not permanent. So the council last year passed Sanctuary City. It's been at the city attorney's office, and I've been working with the city attorney, and so it has now been sent to council. I talked to the council president and asked if he would have it voted on next week.
And what will that provide, assuming that it passes?
It is the protection and, making sure that people know. I mean, I think more than anything, it's the message that says we will stand with you, we will protect you. We're not going to allow, part of it is a reiteration of Special Order 40.
Okay.
But for people to know that, that we are there.
You're there.
The other thing is that people have asked for, we need to do a flood of public education in terms of know your rights. So what I did was I met with a group of the activists yesterday, and I asked them if they would recount the history and if they would critique the history, what worked, what didn't work, back when we went through it before, and if they would help in conjunction with the mayor's office and the council come up with a new plan based on the other.
Gotcha. The election also brought the passage of Measure A. Talk about that a little, and that's estimates I've seen are $1 billion a year, commencing pretty much right away, right? How do you see that money furthering your efforts, and what can we expect or hope from that?
So in our conversations over the last 2 years, you know that one of my biggest concerns has been services. I mean, I'm a little different in the sense that my background is in the medical field, so I look at things through that lens. And I think a real weakness in the system has been standards around services, accountability in terms of what's your outcome. I mean, it's great you house 10 people, but what happened to them? How long did they stay housed?
Yeah.
And if they fell out of housing, why did they fall out of housing? And so I believe that it has been a weak link. By the way, the van outside and UCLA's street medicine and the work that they do. I told them, are they here? Are they in here? I don't know if they stayed in here. But anyway, there you are back there, hiding. I see you. That I feel the medical community has not stepped up, that housing first has meant literally housing first. And to me, it should be housing and services first. So it's part of critiquing the system as well. So the part that I participated in terms of writing Measure A, was the accountability measures, the outcome, having things based on outcome, and also having services clearly defined. And I do not fault for 1 minute the community-based organizations. They are working way beyond, what they have the resources for. But we have to do better because I believe, and we'll see, the future will tell, but I believe that if services were much stronger, much more focused, much more consistent, that people would stay housed longer because we would address what their problems were.
And how?
So that's what Measure A.
So yeah,
sorry,
how does Measure A help you with that?
So part of Measure A goes to building housing.
I see.
Okay, but part of Measure A goes to the services. So when voters passed Measure H years ago, it provided services that was about to expire. So Measure A basically cancels out Measure H early because Measure H was supposed to go out in 27. It cancels it out early and replaces it. It is a sales tax, and it's permanent. And one of the things and that was a criticism of it, by the way, especially from the business community, that leaving it as permanent. But I think that, we were overly optimistic in H and HHH being 10 years. I mean, I've been here 2 years now in this position, and this is going to take a while. I mean, it took us 30 years to get to where we are now. And I watch this, for the young people in the room, we have an entire generation that has grown up thinking that it's normal to have tents on the street. And I think we have to let go of that. This is not normal, and this was not always here. Yeah. And so, but on the other hand, it did take 30 years to get here. It's not going to take 2 years to magically change the whole system.
I've heard you say, in fact, I heard you over at the Chancery Club just the other day, in answer to a question saying you didn't feel you needed more power, but you did feel you needed more money to address this problem. Does Measure H provide you enough money to really?
No, it absolutely is not enough. It's what we could get now. For example, in the city of LA, we know we get at least 60 million, but 60 million is, No, I mean, we have to, as a society, at some point, we have to decide, do we want to solve this problem or not?
Uh-huh.
And if we want to solve the problem, then we have to address it comprehensively, which means we have to prevent people from falling into homelessness to begin with. And when Measure H and HHH was passed, people were not thinking about that. I understand it. I think the numbers at that time was 14,000, and HHH was supposed to build 10,000 units. Well, nobody accounted for the fact that the population would triple. And so it looks like in some people's eyes that Measure H and HHH failed. They didn't. The problem just, exploded. So we are going to need more money, but in my opinion, we need to demonstrate to voters that we are more accountable, we're transparent, we can say what the outcome measures are. So we're going through these audits and all now, and we know what the audits are going to show. But to me, it was very important to jump in and save people's lives as opposed to spend the first 6 months diagnosing what was broken in the system and then spending the next 6 months on trying to fix it. I've been trying to do everything all at once. Conway Collis is here. He's the CEO of the Mayor's Fund. I inherited 2 nonprofits when I took over, and Eric used the Mayor's Fund for COVID relief, and we've changed it, and he's focusing on developing a model for prevention, because by the way, we don't have anything to replicate. There are no models around preventing homelessness. We're having to create models, address homelessness, change laws, and redesign the entire system, all at the same time.
Can I ask you, there's an interesting, I found it anyway, an interesting contrast between your approach and Mayor Breed in San Francisco, who's talked about citing homeless, breaking up encampments, a more forceful approach, I guess, at least tonally, if not in substance, and maybe that too. And her approach seeming more in line with at least the rhetoric of Governor Newsom, who's advocated a more forceful breakup of encampments and whatnot. And I wonder, well, first of all, it turns out not, if that was politically motivated, it wasn't enough to save her since she lost her seat this week. But I wonder what explains, from your perspective, the difference in those two approaches in these 2 prominent cities on the West Coast, and why you have opted for a gentler approach of trying to lure people out of homelessness, where she seemed to have opted for a more forceful approach.
Well, and not talking about her or her approach, I want to solve this. I want to end homelessness. The system was not designed to end homelessness. It was designed to manage homelessness. So if we want to end homelessness, you get people housed and you take care of whatever it is. So to me, it's not a solve versus hard. It's one that is going to work versus isn't going to work. And the thing is that, and that was my concern around Grants Pass. So the Supreme Court basically has said you can arrest people. I think maybe one of the differences is I'm older. I mean, you and I have known each other for a long time.
That's true.
And we've seen this. We know this playbook. That's why I ran, because I was afraid that we were getting ready to repeat history. And in the 90s, which is I think when we first met, that was when mass incarceration was just beginning. And at that point, I was on the faculty at USC Medical School and with students, and I'm watching all these laws pass because of crack. And to me, crack was a health issue. Okay. And so what happens when voters get angry is that then they pass terrible policies. And I frankly think that the reason we are in the situation now is because of bad policies that started really in the 80s. But because we had a fallout of our social safety net in the 80s, by the time the 90s hit, then we just wanted to punish everybody because we were mad. And so voters were saying, we've raised our taxes 3 times, and the problem just gets worse. They're all drug addicts, they're all mentally ill, just get them out of get them away from me, and if they wind up being jailed, fine. Well, you and I know that doesn't work. It doesn't solve the problem, and you can push homeless people down the street. Do you want to end it or not? And I'll tell you what I'm obsessed with is the fact that the world is coming. And so where are we going to push 70,000 people? So we have a choice here. Solve your problems and invite the world, or have the world come and see that you didn't even know how to clean your house. I mean, you don't invite, if you invite guests, you clean your house, right? You even clean your house before the housekeeper gets there, because you don't want the housekeeper to see how dirty it is. So why on earth would we want to invite the world here? And you know, everybody's talking about 2028. I'm talking about 2026.
Coming up quick, yeah.
All-star basketball game, golf, and World Cup last 40 days, 8 games here, 2027, the Super Bowl, then we get around to the Olympics.
Wow, that's a lot coming. Are there cities in the United States, excuse me, that are doing an especially good job of this that we could just copy? I mean, are there models out there that are more effective than what we've got going here?
Well, I think a couple of things. New York, I think New York was effective because they designed a system of long-term interim housing. I remember going and visiting New York when I was in the state legislature, and they were beginning this then. And they bought a lot of hotels and stuff, so they have more homeless people than we do, but there are not as many on the street, and it's not just because of the weather. It's because of this system. Now, they also have a policy of a right to shelter, which, you know, so New York, in terms of building interim the way they did, or rather buying interim. And then Houston, I think, is a model everybody looks at. Houston is different in the sense that they've kind of taken their structure that we have inside of government, placed it outside of government in an independent nonprofit. So now we have several different governance models that we're looking at. But I'm going to tell you, again, what I find everywhere is the absence of health. And I'm not going to let that go. There's a lot of people who wind up being homeless because of medical conditions. I met a woman who eventually got fired from her job. She kept missing work. She wasn't feeling well, didn't really have adequate health care. She was in Texas, so. And she then was diagnosed with cancer. By then, she was living out of her car and had to go through chemotherapy while living in her car. Today, she is living at Hilda Solis's village, which is made up of storage containers, shipping containers.
Shipping containers, yeah. On the housing piece of it, the city doesn't really build housing, right? So your job, as I would understand it, and explain, correct me if I'm wrong, is really more to clear obstacles to construction, to expedite it, one-stop, streamlining, et cetera. But I guess I wonder whether that places too much faith ultimately in the market. I mean, if you streamlined everything and eliminated every obstacle to affordable housing construction,
you'd have a mess.
Yeah, I mean, and also, wouldn't developers still want to develop higher end housing anyway without those obstacles? So how do you create not just more housing, but specifically housing that will help these people who need this?
Well, I think that developers are willing to build affordable housing and lower income housing. I mean, developers are expecting a profit, and there are some developers that are willing to accept a lower profit. And we found that when we did executive directives that expedite it, they were very willing to do that. But you know, one thing about policy is, to me, when you pass a policy, you should evaluate it to see whether it's working or not. I mean,
it's an idea.
Novel. And so we did the executive directive 1, and then it turns out we had some problems with it. And so we revised it and are continuing to revise it. One of the problems that we found was that it was going to essentially unleash a lot of building in single-family neighborhoods that apartments would be. And I know some people think that my concern was the higher income neighborhoods, but actually it was both, but it was the lower income neighborhoods too, because what I found is for-profit developers were chomping at the bit to go to South LA and East LA, and I did not want to be responsible for the total transformation, which I believe ultimately would lead to gentrification. Because you can start off as a low income, but nobody says you have to do that for life.
Right.
And so I was worried that they were going to completely change the character, and they were also going to displace people. Like, I'm just going to displace these 12 families, but I'm actually going to build 40 units. Okay, that's good, but what happens to the 12 families?
How are you measuring success in all of this? What will you, I mean, I know we've seen the tiniest dip, but a dip and a leveling maybe of the number of people who are unhoused on the street in the city and in the county. How will you know a year from now, 2 years from now, whether this is working? How are you measuring your own success?
Well, one, you really do measure it, meaning that if you're bringing people into housing, who are they? What happens to them? How long do they stay there? If they fall out, why did they fall out? So how I will measure myself, first and foremost, is a significant reduction in street homelessness, which I think, we have seen.
Already happened.
A lot more to go. We do have to, success will also will be when Conway figures out the silver bullet to prevention, when we've actually created a model. And the other measure of success to me will be the comprehensive services that are tested, services. So, I have this dream of creating a headquarters, a healing center, maybe in one of the big hotels that we could buy, where we co-locate county services. We have health clinics, we have education, LAUSD, community colleges, we have programming, because I'll tell you, one of the things that scares me to death is that we put these people in these motels and they have some services. What do they do all day and all night? Programming. There needs to be programming. And I frankly think there needs to be 24-hour programming. There needs to be 12-step. There needs to be a lot of things that are not there. And again, I'm not faulting the service providers. They don't have the resources. I came in and, I didn't mean to, sort of, but really kind of exploded their workload.
Yeah, sure.
And so now one could ask me, well, where are we going to get the workforce? As a past working faculty member, there are thousands of students who have to do clinical hours to get their licenses. They have to. It's a part of their education. It's very structured, very documented. And this is a hot topic. So social work, psychologists, physical, you name it, anything in the health field, anything in the social sciences, right, Paco? You got to do your hours. I mean, when I did my master's, I had to do 1,000 hours. Paco trained social workers.
Very good. Well, you will know better than me, but some percentage, obviously, of people who are unhoused are either profoundly ill because they are unhoused or unhoused because they are profoundly ill, right?
Thank
who are
you.
seriously, probably unable to even discern the degree of their own incapacity, right? Whether that's 10% or 30% or 70%, I don't know, but it's some percentage of those people who don't have a place to live or who don't have housing. What happens to them in all of this?
Well, again, I mean, you keep pushing my button. Because it's the services. If you have to have mental health services. But I appreciate the way you framed it, because it really is a chicken and an egg situation. I think their general perception is that people use drugs and they lose their housing. But people don't think about the fact that when you're on the street, there's people that use meth to stay awake all night so that they can survive the night. I challenge anybody here to go sleep out on the streets for 5 days and tell me your mental health is what it was before. Do you know that the fastest growing sector of the unhoused are seniors in their late 60s and 70s? Predominantly women of color. You don't necessarily see them. So the people that you see who are unhoused are the people, in some instances, who are the most seriously ill. And there's some people who are so profoundly ill, they might not even know they're on the street.
Yeah.
And I happen to believe, controversial as it might be, but I happen to believe that some people should be hospitalized involuntarily. And we've taken a step in that direction with the care court. but the care court is voluntary. And the fascinating thing to me is that people who are so offended by me saying that don't seem to be offended by the fact that in our city we run the most expensive mental health institution down the street. It's called Twin Towers. Nobody's hooping and hollering out of what we do, which is we incarcerate people, but somehow I'm taking away their freedom if I hospitalize them to help them. I asked the president of the state senate if there was an appetite in Sacramento. And you know, profound change like that usually does happen bit by, so care court to me is a step in the right direction, but not enough.
I mean, it's hard to see what agency or autonomy or freedom we're protecting for a person who's that disturbed.
We're letting them die in public.
Do you think there's the possibility?
Oh, by the way, I mean, we're not just letting them die in public, we're letting them hurt people.
Yeah.
So what we do as a society is we let people deteriorate to the point of committing crimes, hurting people, or hurting themselves. How many times do you drive down the street and see people walking in the middle of the street? I mean, I get the reports 24 hours a day of people who are killed in traffic accidents. And I know that a percentage of them are mentally ill there because they're walking in the middle of the street at night.
Of course, yeah.
Or on the freeway, the freeway was backed up 2 days ago for somebody walking on the freeway.
I'm going to turn to all of you in just a moment, so I don't want to monopolize you. But I am curious. This is an audience of people who care or willing to turn out and hear this, obviously.
Willing to go through traffic.
Right.
Here.
What should we do? I mean, we voted one way or another, presumably many of us for yes for Measure A. But what would you have everyday people do to help with this crisis?
Well, I mean, I think that there's a variety of things. One, you know, you can join in when there's an encampment in the neighborhood and people let us know and we house the people. And then we ask the people in the neighborhood, please tell us if you see one tent. What a lot of people might not realize is that an encampment is a little community. And so when you see one tent, in a few days you'll see more because people try to be together to protect each other. So let us know. There's one area right now where there was a really bad encampment for a really long time. And we housed everybody, but the sidewalk is really big. It's almost like as big as this stage, which means that if we don't do something, we're gonna always be chasing tents, right? So we're looking at that sidewalk to maybe put up like outside gym equipment or something that prevents people from coming back. We've used a lot of different examples like that. But because of this veteran piece, I'm looking forward to calling on Angelenos to house a veteran. We have the money. We raised the price of the vouchers. We have the vouchers. We have the veterans. We need the landlords. So I'm beginning conversations with the apartment association, the realtors, to say, do your patriotic duty and take in a veteran. I think people look at sectors of the unhoused population differently. Foster youth, who we make homeless by when they turn 18 or 21, we cut them off, we hand them their belongings, and we tell them good luck. That's policy that makes you homeless. People are more empathetic toward that group, more empathetic toward the woman who's fleeing domestic violence, more empathetic toward the senior and veterans. So there's certain sectors we shun and certain sectors we say, okay, you didn't deserve to be like that.
Do you give money to people when they ask you for money?
Sometimes, yeah.
Is that, should we? Should people? Is that a
I think
constructive way to help?
I used to call it, LA's toll bridge. It depends. Sometimes I bought food instead of money. So it just depends on the situation. I don't say you shouldn't do that. But here's the thing, is that what we've been doing as a society is we feed the homeless, we clothe the homeless, we give them money, we give them food. We don't solve a damn problem.
You know, I know we have some representatives here from the Genesee Center, which I know you've been involved in over the years. And obviously, domestic violence often contributes to people being homeless. Is there more we can be doing there, too?
Yeah, well, I mean, and domestic violence is one of the leading causes of women being homeless and children. So you know that we have over 9,000 children, not foster, not 18-year-olds or 21-year-olds, but school-age children. LA Unified, I met with the superintendent right away. He's very interested in addressing the issue. He knows about it personally. And so, you know, teachers all around have to deal with clothes and food and all. But the biggest thing where I would like to ask for your help is, number one, just your understanding. I mean, this to solve this problem is expensive. And in my belief, you know, sometimes I'm not sure the money is spent the best. But just think about how much money it costs when you leave people on the street. Aside from the inhumanity of people dying on the street, the fires, the fire department, the emergency rooms, the police calls. One thing that we can document is that when the individuals in an encampment are housed, decrease in police, decrease in fire. We have line items in the budget, tens of millions of dollars, that's there to clean streets, but not house people. So you clean the street, you tell the people to move their tents across the street, and then you let them move right back. We wouldn't have to spend that money. We spend millions on hygiene centers, all the things we do where we spend money because we won't solve the problem, or haven't solved the problem.
Okay, I'm going to pause and ask for some questions. I am going to ask one favor of you. When I know it's tempting when you have the mayor to just unburden yourself. Please try to ask a question. We have some microphones that yes, sir, in the red.
I'll be quick and I'll be bold.
Yeah, well, good for you.
Respectfully bold. I came here today to say something that might sound strange, but I have a solution for you, Mayor. I'm representing a company who builds affordable permanent housing. That's not my job with them. I do the wraparound comprehensive case management. So, you know, in other words, I deal with the not in my neighborhood people. Mm. But they build durable, I've seen them, nice, permanent housing units. So I've been in this field dealing with the homeless and in danger of being homeless people for over 20 years. And I've longed for more than 20 years for a solution to this problem. I come here today because I now have a solution.
All right.
So I just wanted to come today boldly to let you know that, and I know I can't speak with you. I know there's many layers. But in closing, I would love to speak to someone to start up that chain of command so that you can meet these people and we can talk about it, because I'm not blowing smoke. It's real, it's viable, and please take it seriously and utilize it.
Well, let me just tell you how serious I'll take it, because ironically, it's so ironic that you that you're saying this today, because literally this morning into this afternoon, we had a housing fair, because people come up and tell me this often, different designs they have. So we brought all of the builders together today, and we had a housing fair where we invited, I invited 87 other mayors. We invited all these folks to see different ways. And I think that there's better models of congregate, because we have to find a less expensive way than motels. Yeah, and so we're in the middle of changing that. And the other thing, especially because of Grants Pass, is we're trying to come up with collaborative shelters so that multiple cities can send people to the same place, so that they don't just send them, across a boundary. So we will follow up on you. We are going to do another housing fair. Wished I would have talked to you yesterday.
Well,
good.
Okay.
Okay.
Give a sec. Thank you, sir. We appreciate your input. And if you've got material, get it to us. We'll be sure that the mayor's office gets it too. Sir, in the baseball cap there with your hand up there.
Thank you, Mayor Bass and UCLA. My name is Aaron. I represent Creed Academy. We're a charter school serving unhoused youth in South Central LA. Wow,
good for you.
Students had the opportunity to trick or treat with you a few weeks ago, so thank you so much for that. So last year, the data was over 17,000 unhoused youth in LAUSD.
17,000.
Over 17,000
Wow.
for the 2023-2024 school year. There's over 50,000 reported through a UCLA study in LA County. My question to you is, how do you distinguish solutions for addressing childhood homelessness versus those like adults? And how can we lift children and families out of homelessness within the existing framework that you discussed today?
Yeah, well, let me just say that one of the things our teams haven't found a lot, which are the children, because the children tend to hide and also tend to be in vehicles, and so and sometimes hide in tents too. So we have gone into tents or knocked on tents where a mom is hiding a kid because they're worried about DCFS coming and taking the kid away. But clearly we have to have housing for families. We have to view it that way. Now, there is the whole sector that's coming into town that are the migrants, which to me is an entirely different group with different needs, different journeys. And so we are addressing them differently through the immigrant rights infrastructure that we're fortunate to have here. But you have to address it comprehensively. But so far, our teams have not encountered tons of children.
Thank you.
Let me
Sure.
come over this side here. You, ma'am, yes, raise your hand. I think we can get your microphone too.
Okay, thank you. Hello, Mayor Bass. Thank you, UCLA, for having this opportunity for us to address the mayor. I'm with Community Coalition.
I think I recognize that logo.
I am the prevention manager, so I have a provider question for you.
Yeah.
So you talked a little bit about the providers and how you needed more support for them and that
Yes.
sort of thing. Which providers were, outstanding out of all of the efforts that you've been doing to house the unhoused, and which providers that you found yourself that were successful in helping you in that effort?
So that's a really hard question to ask me in this setting. That's okay, because I'm not going to tell you. No. Seriously, I think that the providers are doing a yeoman's job. I really do, especially, and by the way, I hate the fact that we make it so difficult for them because one, the city takes so long to pay. And then what we pay, we know doesn't cover. They've had to take out lines of credit and then, they run up interest rates. And having run nonprofits, the Community Coalition and others, I know what that means. I know what that means to wait to be reimbursed and to meet payroll. So I really think, again, there's just so many parts of the system that are broken. I could spend the whole evening telling you about all the things. And so I think that, the providers, again, are doing what we've asked them to do. I just think what we asked them to do is lacking. Does that make sense?
Yes. Thank you so much.
And just because she won't answer your question doesn't mean it wasn't a good question.
That's correct.
Yes, sir, right here.
Hi, I'm from the Daily Bruin at UCLA, and so now I'm wondering what has UCLA done for homelessness, and if anything, and what more could they theoretically do for homelessness?
I think well, first of all, we work with the UCLA street medicine team, and we work with USC too. So we have contracts with both, and they help us tremendously, UCLA and USC, by going out on the street, by seeing folks and diagnosing them right there. What I really like about them is that when we move the individuals inside, they stick with them. So one of the biggest problems with people on the street, or people who are housing insecure, period, is consistency with their health care. And especially as the population ages, if you're diabetic or hypertensive, you can't just take medicine sometimes. You have to be consistent and you have to be followed consistently. So that's what we do. And then there's UCLA research, which sometimes there's a disconnect there in terms of research that is done, but we don't necessarily know about it, or it's not necessarily collaborative. What I wish UCLA would do, though, since you asked, is I really want to do a study of the city to see how we spend money related to poverty. Because what I have found in my short time is that poverty is spread all out. I mean, the DWP has programs relating to poverty, okay? a lot of low-income programs. I'd like to know all of the dollars that are spent on low-income Angelenos and how we rethink some of that, maybe consolidate, restructure. What my frustration is, and this is just not in homelessness, it's everywhere, where there's basically no measurements of what you're doing, and I'm not used to that. Coming out of the medical field and coming out of the university, I'm used to you have to have goals and milestones and, and metrics that determine whether or not what you're doing is making a difference.
Okay, I'm just going to interject for a moment to say that you are the 6th mayor that I have covered, and that's the first time I've ever heard a mayor ask for somebody outside to study whether you're doing a good job. So, all right.
Thanks.
I appreciate that.
I actually have lots of requests.
Yes, sir.
Good evening, Madam Mayor. My name is Miran Kalajan, and I'm also a commissioner on the Police Advisory. When COVID hit the city of LA, recreation and parks provided shelter and food for the homeless. However, now with budget cuts, this department doesn't have resources or personnel to take care of the homeless. The same goes for sanitation and LAPD and many departments that they provide services to the homeless. My question, how will you convince the CAO office to stop the elimination of many jobs that are being paid by grants and external funding, not affecting city budget? Still, these jobs are frozen and services lost. Finally, we must keep all the jobs paid outside the budget filled to service Los Angeles.
So Parks and Rec, it's not my belief or understanding that Parks and Rec is not providing homeless services anymore because of the budget. That was, pretty much being eliminated as COVID was resolved, and people want their parks back. So, to me, I don't think it's a good solution for parks to do that, because then that conflicts with families and the use. In terms of the elimination of jobs that are based on grants, I don't think that that's accurate. We are in tight budget times. There is no question about that. Hiring has to be very, very targeted, but we have not stopped and won't stop the hiring of police officers. Now, I'll tell you, I focused a lot on that in my first few months, and put a lot of money into recruitment and marketing. And by the way, we succeeded in recruitment. I just can't get them hired through the city process. So now we're having to change that. So you know what my success has been there, Jim?
Tell me.
I've been successful recruiting police officers for every other department but ours. Because the young folks get frustrated, it takes too long, and then they go become a sheriff or work for Culver City or Beverly Hills. So the new chief, his first order of business is to correct the hiring process. I know what's wrong. I know what's broken in it. It took me a while to figure it out. And so we're changing that. We're hiring 911 operators. We're 136 short. So we're going to keep doing that. So anyway, I think that's, not entirely accurate, some of the things.
Yes, if we can get a mic to you here in the middle. Is that okay?
All right, if you shout, we'll repeat.
Right. And we have time for maybe one or two more, so thank you. Okay.
I guess I'll stand here
Yeah.
to give it back. My name's Adam from the LA Community Action Network in Skid Row. As Mr. Newton alluded to, your approach being gentler than Mayor Breed. And we know while Inside Safe is bringing people into shelters, we know that the total number of folks brought in through Inside Safe has only been a few thousand, and a third of those have already exited for a variety of reasons. And so I'm wondering, are you concerned that to the average Angelino who sees, media coverage and things around Inside Safe as success, and I'm not knocking it, I know a lot of people personally that are in Inside Safe, but just numbers-wise, there's only a few thousand people that have been brought in, spending $6,500 per person per month. Are you concerned that the narrative to the average Angelino sees success, and when they go out on the block and see an encampment that hasn't, because it's not been prioritized by Inside Safe, because you prioritize particular encampments, that raises this narrative that the overwhelming amount of homeless people in the city are somehow service resistant when there's just not offers to 40,000 people?
Well, you know what? I mean, I don't, one of the things I feel that we proved in our first year is that it's a myth that people won't go inside. And I think being service resistant is a myth as well. I believe we could bring in 90+% of the people outside if we had the housing and if we had the rooms. As you mentioned, it's too expensive what we're doing now. I would debate some of the numbers that you threw out there, but I think your basic points are correct. It is too expensive. I work with LA CAN, you know that. I understand your advocacy work and appreciate it. The other thing you said is about people exiting. Yeah, I think I've been talking about that the whole way. I'm very concerned about that. Again, I would dispute your numbers, but the fact that people do leave, we've had people die. And I'm concerned about that. And not everybody has passed away due to overdoses, but I would say the majority have been. So when I talked about how I've been trying to house people and transform the system at the same time and change all the laws and get the money, all of that has to be done at the same time. And by the way, Inside Safe is just one part of many layers of strategy. And so when we talk about the 17,000 number, we are talking about that from a variety of different ways. Not everything is Inside Safe. It's just that Inside Safe gets the most publicity. And then you are correct, we can't do every encampment. If we could, if we had the rooms, we would do every encampment. And I do think, though, that you can talk to thousands of neighbors around this city who had been plagued by encampments in front of schools, in front of businesses, that are relieved because the encampments have not repopulated. Now, let me just mention a couple of things about repopulation, because some of it is fascinating. The unhoused population is resilient, which is why they have survived. So some of what happens is when we clear an encampment and house the people, other unhoused folks will come at the same place because they know, and they will say, well, we came here because you cleared this encampment last week, and we know you'll come back again. And they are correct. We will do that because we do surveillance on all of the areas that we cleared, which is why you haven't seen people come back. Does that mean everybody's been housed? Of course not. It means that they're unhoused in other areas. If I had the rooms, we could end street homelessness.
I know you've been eager to ask one, so one last question. Yes, you, sir.
Thank you, Mayor Bass. You've been very successful at getting people into new units. One of the things that we are starting to see is that there is less capacity in the service provider space, and that, as you said, service provision is an important part of this puzzle. How are we going to stop this issue of not having enough case managers to help these folks?
You know, it's funny, my last meeting in the office today was about that exact issue. We have to look at a redesign, I believe. And I think that it's possible to do a redesign. I mentioned before that we have thousands of students in this city on every profession that you could think of. They are required to do clinical hours. And so I think that we can establish collaborations. There's also all of the county services that the unhoused population might not. It's, you know, you give somebody an appointment and then say, okay, go to your county office. That's a journey in and of itself. And having spent years working at the county in that system, you know, that's difficult. People need more assistance than that. So I honestly believe there needs to be a redesign. Again, I think the providers have been asked to do way more than they have the capacity for.
We're going to bring things to a close here. Before we do, first of all, I want to say thank you, a special thank you to Duane Muller, who really pulled this event off today. So thank you, Duane. And before I turn it over to Myra to say goodnight, just one point of personal privilege. We have all been reminded this week that elections matter. But I just would, I hope, leave you with a heartening thought that it's not just elections for president that matter, but elections for governor and for supervisor and for city council member and for mayor. And we are grateful for you. Thank you.
Thank you. Thank you, everyone.
Myra?
Thank you, everybody, for spending a bit of your day with us here today. And thank you so much, Jim and Mayor Karen Bass, on this insightful conversation, because we know this is such a complex issue. I'm Myra Mariag with CalMatters. For those of you who are not familiar with CalMatters, we're a nonprofit, nonpartisan news organization, and we are expanding our coverage here, focused on Los Angeles. And it was an honor to partner with UCLA on this event to bring more insightful conversations like this in our communities. So thank you all for spending some of your time with us, and please get home safe. We know everybody has commuted from various different locations, but thank you, everyone, and thank you again to the UCLA.